Hey there, my name is Dr. Seth Myers with Sinus Spine Sport and Rehab, and I'm making this video or audio if you choose to listen. I am going to put this on the Moving Forward podcast, so if you'd rather just listen, you can go check it out there. But I am making this video doing a follow-up to the previous video I made talking about exercise as a treatment for low back pain. So in summary, if you didn't see that video, which by the way, you should go check it out. If you didn't see that video, basically what I did is I took a quick look at the research regarding exercise as a treatment for low back pain, and time again, the research tells us that exercise is actually a really good treatment option, and it is generally superior than most other treatment options that we have for low back pain. And if we look at, is there specific exercises or a set of exercises that is better than another? The answer is not really. They all seem to do pretty good, which means as an individual dealing with low back pain, that is kind of nice to hear, because then you can try and tailor a specific exercise program to you. You don't have to do specific exercises for you to feel certain results. We just want to get moving again. So that was a quick summary of what I talked about last time. Now let's talk about, okay, just because exercise is good, now what should I do? How should I, as a patient dealing with low back pain, if I'm currently active or if I'm not being active, how can I try and set up on my own a little plan? How can I tweak different variables to try and start combating low back pain on my own? So I came up with a short list of things that pop in my mind when I think about this, and hopefully these are helpful for you. The first thing that I tell folks, or that I try and get across to people, is we want to consider exercise when we're dealing with low back pain as essentially medicine, in the sense that for the medicine to be effective, we want to find the most effective dose. Because a lot of times when you say the word exercise, people just intuition pops in their brain, like what they think exercise is, and it's kind of a black and white thing for the most part. So if someone hears you say exercise is good, you should consider exercising for low back pain, they might think that you're saying, hey, go run on the treadmill for a mile, and then after that do a couple sets of bench press, and then make sure you do some bicep curls. That might be the thing that they think of when you say exercise. The reality is, you want to think about exercise as being, obviously any of those movements that you can do, but we want to try and find the right dose of exercise that the patient is going to be able to do and get some benefit in terms of trying to get that low back a little bit stronger, a little bit more resilient, and not flare up symptoms, right? So consider exercise could mean lots of things, but we want to try and find the right dose, because obviously there's lots of people who have been dealing with low back pain who just kind of keep doing the thing, or they keep exercising. And if exercise is supposed to be so good, how come that doesn't help? Well, it's probably because they don't have the right dose down, and maybe if they tweak some of the variables we're going to talk about, they could kind of fight their way out of having such chronic low back pain. But let's move on to some rules that I typically tell folks when they want to continue moving while they're dealing with some pain. So this is 2 generic rules that I have, and this is, again, I'm starting super basic and I'm going to get into some more specifics, but as a rule of thumb, like we said from the previous video, there's not really any one set of exercises that is good or bad for the low back, which means as a person dealing with pain, you have the right to go dabble and try some exercises either you haven't done before, or maybe you have in the past but just have flared things up, so you can kind of poke the bear slightly. The 2 rules that I tell folks time and time again when they're in my office, though, is to know if you're doing too much. I would follow 2 rules. Number 1 being, while we're doing the exercise that we're testing, we want to try and make sure that we don't let pain crawl above about a 4 or so out of 10. This is kind of sort of an arbitrary number, but generally speaking, if pain stays in the 3 to 4 and below range, you're usually not stirring the pot so much that we really flare up symptoms. Once we get into the 5, 6, 7, while we're doing the exercise, usually that's a good indication that we're probably doing a little bit too much in the moment. Now, pain while we're doing an activity isn't a great indicator of what we're going to have the next day. So that's the second rule for deciding what we should be doing exercise-wise, if it's too much or not. So you want to see if your symptoms flare up or get worse than they were previously in the next 24 to 48 hours after you've tried that exercise. So let's just say your exercise is running, you want to give it a shot, While you run, pain was never more than a 3. But 24 hours after you ran, that thing is achy, throbby, much more than it normally is on a normal day. That means we probably did too much. Even though the pain in the moment wasn't super high, we probably overdid it, right? So these rules kind of help give us some check and balances to make sure we're not overdoing it in the moment, but also that we're not overdoing it just because symptoms weren't there while we were doing it. The nice thing though is about these rules is, well, the bad thing is you have to do the exercise or try a movement out first, and then you're not going to know until 24 to 48 hours later if it was too much or not. But the nice thing is, because we've got these 2 rules in place, you as a person can kind of experiment and come up with maybe a short list of exercises or activities that you can do and you can get away with that don't consistently flare up symptoms. And so now you've got some options to try and work through those movements and slowly over time progress those things, right? So it gives the patient some freedom, and then usually I tell them, hey, report back to me, let me know how symptoms are doing, because then we can kind of on a much smarter level try and progress those things while we're still trying to rehab that injury. But those are the 2 rules that I have for folks when they're in my office, when they're asking, hey, what should I do, right? A little bit more specific advice or some more practical things that you can do without necessarily even following these rules, but you would follow these rules with that. It would be, we could simply just change range of motion of a movement. So if we're talking about low back pain, 2 movements that constantly pop up when we're talking about exercises, squats and deadlifts, those are actually very, very easy to just change your range of motion. So, if you're doing some squats, you could look at doing a box squat, and there's really no wrong way to do that thing. So you could do a really, really, really high box squat. So you're still getting that movement for the most part, but you're putting that box high enough up to where we're not putting a ton of load and stress on the low back. And again, that would be something where we just kind of have to play around with not just the height, but play around with the movement in and of itself. See if during the movement it gives us pain, see if afterwards, the next day, we flare up. The other one would be deadlifts. Again, this one's pretty easy to change the range of motion. A lot of times I'll have folks raise the bar up, so it's usually putting the weights on some sort of box or a plate or whatever to raise that bar up from its normal starting position. So you're essentially doing a rack pull, or you're doing like a pull from the knees, something like that. And those that change in that range of motion might be enough of an offload of those tissues in the short term to allow you to keep doing that movement and again slowly progress using those 2 rules that we said earlier to continue to exercise, work out, all those great things. Again, some other practical tips when you're talking about still wanting to move around and exercise is just taking some weight off the bar. That's pretty straightforward. A lot of times, especially if it's a mechanical issue, some joints are inflamed or whatever, just the mechanical load in and of itself can be enough to irritate symptoms. So if we take weight down enough, then we might be able to continue doing that movement. And if that's the case, typically my recommendation would be to bring weight down, but actually bump up the reps so that we're still getting a pretty good stimulus there. Although I will say there has been times, even for myself, where the opposite actually feels better. So decreasing the rep count. So you're only doing 1 to 3 reps in total, but you're kind of taking the weight up a little bit. And when I say this, keep in mind we're talking about while someone's dealing with pain, while someone's rehabbing an injury. So when I say take weight up a little bit, I mean based off of what you would have previously done for the lighter weight, higher rep. So I'm not suggesting go do a 1 rep max by any means, but I'm just saying a heavier load, but for a lower rep count. There's been times where maybe my knees are a little bit achy or whatever the case might be, where for whatever reason, just doing 2 reps and racking the weight feels much, much better than keeping that bar on my back for 8 total reps. So those shorter sets with a little bit heavier load can be an option, right? I would actually probably recommend trying lighter weights first and slowly building up to that. But that's an option that has worked for me in the past, where I've actually gone a little bit heavier than I normally would train, but I'm keeping the rep count low for each set. So that's an option. Another thing to consider is just time for recovery. And so, like I mentioned before, we want to give ourselves 24 to 48 hours to see if we flare up from doing an activity. But sometimes I think one of the things that flares folks up when they're dealing with pain, and not just low back pain, but pain across the board, is a total cumulative effect of exercise. So maybe day one, you did something, day two, you did something else. And those things can kind of have an additive effect for increasing symptoms. So one option would be just increasing how many rest days or how many days in between similar movements that you do. So decreasing the frequency of how often you're hitting those things. And that's just an option again, right? So if you're having no problems at all with the current frequency you're doing, then I wouldn't recommend this for you. But if you're trying to get back into exercise and you're noticing that things are flaring up every time you try to do something, or maybe it's at the end of the week, your symptoms are flared up, what you might do is try and increase the frequency of rest days or time away from doing certain movements that we know flared up, and kind of take some load off in that manner. So that's one way. And then some other things, practically speaking, would be if you're somebody who's exercising or you're someone who hasn't exercised at all, but you want to try to get more active dealing with this low back pain, is you can just switch up the exercise modality in and of itself. So let's say you're somebody who is lifting heavier weights, you're a powerlifter, strongman, CrossFit, whatever, and you're used to doing some pretty aggressive resistance training. Maybe for a short period of time, you kind of dabble into some endurance-based training, whether that's running, cycling, rowing. Maybe it's HIIT interval stuff where you're keeping the total volume and the total weight of the thing you're moving, the implement that you're moving, relatively low. And then maybe we've got a case where it's the opposite, right? So maybe you're someone who's endurance-based training, you're a runner, you're a cyclist, you're a triathlon or a triathlete, and maybe for a short period of time what you do is increase how much resistance training you're doing and decrease how much endurance training you're doing. Just kind of switch up the modalities and keep that body moving, but do it in a different fashion so that you can allow the tissues that you had been using to kind of unload slightly. And again, I say all this with the umbrella of those two rules I said earlier, which is why I said them at the beginning, is maybe you're a power lifter who's got some low back pain and now you want to switch to running or cycling for a short period of time. We're talking days to weeks potentially. But you try it and it flares up symptoms, right? So everything that I said as a recommendation is really just one different potential way to try and change symptoms, right? So those are like some of the low-hanging fruit things that we can change initially. Some other things that you could get into would be looking at stuff outside of the gym. Everything that I had mentioned here is stuff that you would do kind of while you're training, changing the load, changing the frequency, whatever. But you could look at outside the gym stuff. Is there some low-hanging fruit in life that might help us out? A really big one that I think of is sleep and nutrition. Sleep probably a little bit more so in the sense of, hey, not going to bed till midnight, which is me, so I need to work on that. And so if you can get another hour or more of sleep each night, that might have a bigger impact than messing around with a lot of the things we're doing inside the gym. If we can dial in our nutrition to make sure that we've got just an even spread across the board of protein, carbs, and fats, things of that nature, maybe decreasing how many just generic grams of sugar we're taking in, just small stuff. That might have a slight impact. And so when you start to stack these different variables that you can play with that are really none of these are very crazy at all. Like I'm sure a personal trainer can come up with most of these things and it wouldn't be that surprising. But you can start to mix and match different variables, including some outside the gym stuff, and see if we kind of come up with, again, that right dose of specific exercises that can help us get past this little bout of low back pain. Oh, I did think of one while I was talking. Another practical thing that you can try or change when you're talking about exercise would be to mess around with doing some single arm or single leg stuff. If we're talking about low back pain, I'd probably recommend like single leg activities. So single leg squats, like split squats, single leg deadlifts, things of that nature. Part of the reason is there's multiple reasons. One, you could argue that you're challenging stability a little bit more, so maybe it's got a pretty good effect on improving low back and overall core stability. So there's that. But another like super practical thing about single leg movements is you just physically can't lift as much weight with one leg compared to two. So if you're used to squatting and deadlifting with two legs, your total weight that is now being supported by your frame is way higher when you're on two legs compared to one. On one leg, you're only going to be able to move a smaller amount of weight, which means there's just less mechanical load on those tissues. But if you ask anybody who's done a lot of single leg deadlifts, single leg split squats especially, they can still make you super sore. So that's another really good hack, if you will, for different exercise options to try and keep moving, keep being active while currently dealing with some bout of pain. Hopefully this short list of my tips, tricks, recommendations was helpful. If you've got others that you want to throw my way, of course I've got lots of others. These are just some of the ones that were on top of my head, but if you've got others, you can please comment them or reach out to me and let me know some tips and tricks that you use. But if you liked this episode, if you thought it was helpful, I'd love it if you liked and shared it. And thanks for watching and listening.